Da, 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 da. Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. My guest today is Dr. Harry Matossian and his wife, Mary Matossian, who wrote a book called I Love Bacon, But I Love Me More. Please welcome them to the show. It's so nice to meet you.
Thank you.
That's great. It's great to have this opportunity to share this information.
Yeah, well, that's quite a catchy title for a book.
Thank you. You know, I love bacon and I grew up on bacon and it was my maiden name as well. So I had a special connection to bacon, and it was a compilation of all, I call it the common knowledge of the plant-based movements and what I needed to know to make very powerful and big changes where I was not willing to go back to the standard American diet.
What did the standard American diet do to you?
Well, we're going to get right into that. So we're going to share the screen here. We're going to share the screen and we're going to get right into that. So here it is. I had metabolic syndrome. Excellent. So I had metabolic syndrome for 12 years. That was 2000.
I just lost your sound. I can't hear you.
Okay. So let's go.
Can you guys hear them? I cannot hear them. Can you guys tell me in the chat if you can hear her?
Can you hear us now?
So we'll do stop screen.
Stop share.
Can you hear us now?
Can you hear us now?
What the hell's going on?
It says mute. It did say mute up there.
That's muted.
Can you hear us now?
We can't even
We're
see
not
her.
even in the
She's-
meeting. Oh, live. God. What's going on? No. Where are we? I don't think we're in the video anymore.
We stopped
We
video.
lost
So
her.
that's where I thought maybe, that's odd that we were all together and then,
Can
Oh,
you-
there she is.
here you go.
Oh, okay. That has only luckily happened once in over a year. So why don't we start over? Well, let's just see if I'll see if I can get the chat back, but apologize for the disconnect. Once again, I'm Chef AJ. Welcome to Chef AJ Live. Today I'm going to be talking to Dr. Harry Matossian and his wife, Dr. Mary. She's not Dr. Mary, but she's a nurse. She's like a nurse. You like Dr. Mary. I got all frazzled from the tech, but she wrote a book called I Love Bacon, But I Love Me More. Take two.
Thank you so much. It's such a privilege to be here with you, Chef AJ. I just feel like I'm on Oprah. This is just so exciting, and it is prolific what you've done for this movement, and we thank you so much for that, and to give us the opportunity to share our passion and abundance and knowledge about this movement. What I'd like to go right into is I struggled with metabolic syndrome for 12 years. So I had that condition for 12 years. I'm going to share the screen. This is right from my book. It's a very simple illustration. And I had high cholesterol, high blood pressure, fatty liver. I had high blood pressure, and I was extremely depressed. I was very young, and I felt that it was consuming more and more of my time. I saw multiple doctors. I also was on multiple medications, and I was not getting better. It was the time of my life. I had such severe anxiety and depression. I felt like my organs were rotting. I truly felt hopeless. And as we know, metabolic syndrome is the gateway to chronic disease. So diabetes was showing up. I was pre-diabetic. I was very, very concerned. So I want to just share this lovely picture of my family. This had to be about 15 years ago. And I kept thinking, Chef AJ, I thought, I deserve better. I was working very hard. I worked at a surgery center. I worked in our gastroenterology practice. I was a biometrics nurse. And what I wanted to share was there was a very high emotional cost to feeling lousy. I followed all the rules, and yet I was confused. And because I was confused, I could not make progress in getting out of metabolic disorder. My poor health was impacting my relationships with my husband, with my children, and with others. So I want to share 4 truths that came to me during this incredible challenge. One of them was nobody could rescue me, even though I was on multiple medications. I felt that I was left behind. I also realized I had to save myself. And then I had to believe that there was a solution out there. I didn't know what the solution was, but I had to believe in the solution, and I searched and searched. And I knew I was gonna die an early death. My mother, at my age, she had Alzheimer's, and she was institutionalized in her early 60s. And she was always an example for me of, you can do better, you live brighter. And I was always so grateful to that. Staying on this picture, the family portrait, after traveling the world looking for a solution, I did 2 trips to India. I went to, and every time I went to India, I got miraculously better. So I studied yoga, I studied meditation, I studied the Eastern medicine. I took classes there as a nurse in India. And I finally, every time I came back to the United States, I was miraculously healed or miraculously sick again. And I did not make the connection. And I kept hearing about the True North Clinic in Santa Rosa, which is the same town that I was living in, we were living in, and that is a monitored water fasting center. I was there for 4 days and lost 7 pounds. My blood pressure went from 170 over 110 to 110 over 70. And it was so crystal clear to me, it was the food, and it was the food alone. I was so excited by this sudden solution that I discovered that I thought, well, maybe it's not true. I'm going to take every single class available. And I took over 200 units on whole nutrition. I took classes with Dr. John McDougall. I went to the PCRM and did the International Nutrition Conference. I did Plantrition project in Oakland. And my passion was, if it was this difficult for me to learn this basic fact about food, and I'm highly educated, it must be even more challenging for people that are not in the field. So I formulated an experiential class, and it's called Truth in Food, the Blood Knows. Before I taught this class, I was a biometrics nurse. So I knew biometrics nurses. We were all comrades. I invested in the Colistec machines. We taught classes at the Santa Rosa Junior College. I hired these women, and we would test people's blood, and we would challenge them to a very basic diet. And what I had to really keep my mind wrapped around was rice, beans, vegetables. My other favorite is baked potato, steamed broccoli, and marinara. And the name of my class was called Truth in Food, the Blood Knows. Everybody that took this class had an aha moment, because just for 2 weeks, I said, don't eat meat, don't eat cheese. And we met midweek to see how it was going and how people were feeling. It was truly the happiest day of my life when I taught this class. I even took comedy classes, I took improv classes, I took speech classes. I wanted to really share this message of food and encourage people to make this very big change. So now I'm gonna, just about to change over, but that day, the happiest day of my life, our home burned down. And one of the biggest horrific surprises, I'm gonna just get you there. Here it is right here. So we left the cars behind, I left the wallet behind, nothing came with me. There was a fire at 2:15 in the morning, and I woke up because I was hot and the room was this bright glow. And I couldn't understand that. And I realized I was in trouble. There was no way out. And I had clarity of mind, and I was fast. And I knew suddenly I had all these downloads on what I needed to do to escape this fire. I knew I needed tennis shoes to run out of the fire. I knew I needed a raincoat because it was 70-mile-per-hour winds, and all I needed was my cell phone. So everything else was left behind. And there was, again, these 4 truths came to me again. I just want to share them with you. Nobody was coming to my rescue. The city was under siege, and there was utter chaos. And that I had truly been left behind. And I had to save myself. Nobody was going to save me. And I had to believe in a solution, because I knew the house was about to collapse, and I knew that I only had minutes to get out of the house. And I just remember going, wow, this is very similar to my chronic disease disorder, where I needed help and I needed a solution, and I had to believe in a solution. I'm going to show you the next picture here. So this is my son standing next to our 2 cars. It's a Subaru and a Honda Pilot. And then this is the actual neighborhood. This is Fountain Grove. These homes burned for weeks at over 2,000 degrees elevation. 10,000 homes were lost. 40 people died in Santa Rosa. Several people died in our neighborhood. I am truly grateful to be alive. 70% of people did not rebuild. I'm gonna, let's see, and then we're gonna go right into this next one. So I just want to read this slide to you. Is our body has an unlimited capacity to store fat in the abdomen and liver, causing fatty liver disease. And Harry's going to take over from here.
Okay, well, do you want to get rid of the picture?
Oh, sure.
So I just want to share some facts with everyone, and then we can talk about the typical patient that I see. I'm a gastroenterologist. I'm a clinical gastroenterologist. I've been seeing patients now. This is my 4th decade. So I've seen thousands and thousands of patients. And the typical patient that I see every day we're going to talk about, and Mary had mentioned the metabolic syndrome. I just want to share some facts with you first. One is that the US healthcare system today, we are spending more and more money. And just in 2019, the annual healthcare expenditure was about $3.5 trillion. It was estimated that by in the next 5 years, it was going to go up to $5.5 trillion. And so this is sort of an unsustainable path that we're going through. Today, why is that? Well, because we're dealing with a sicker population. The life expectancy in the United States has been dropping sequentially since the year 2014. That's a red flag. Why is that happening? Today, 70% of the US population is overweight and 40% is obese. And there are consequences that come with this weight problem. And one of them is the metabolic syndrome. All of you that's out there listening to this talk should be very familiar with the term metabolic syndrome, because this is the #1 health issue which is running rampant through our society, resulting in unnecessary suffering and premature death, not only in the United States, but also worldwide. It's a huge, huge problem. The typical patient that I see in front of me every single day is, I'm going to call him John Doe for giving the person the name. He's going to be overweight. As I said, 70% are overweight in the US. He's going to have high blood pressure. So he's going to be on 1 or 2 different blood pressure medicines. He's going to have diabetes. And so he's going to be on 1 or 2 different diabetes medicines. He's going to have hyperlipidemia. So he's going to be on some kind of a statin. He's going to complain of multiple issues. The metabolic syndrome, the criteria that Mary mentioned, is simply the tip of the iceberg to the other issues that go along with this patient cohort. And the main issues are truncal obesity, hypertension, hyperlipidemia, adult onset diabetes, and fatty liver. But this cohort also has higher incidence of cardiovascular disease, higher incidence of all malignancies. So the typical John Doe sitting in front of me, he's going to complain of chronic heartburn and indigestion because this goes along with the weight problem. So they're going to be placed on like an acid reduction medication, or omeprazole or famotidine, whatever it is. They're going to complain of chronic constipation, abdominal bloating, cramping, pain, nausea. Why? Because they have lack of adequate fiber in the diet. 90 to 95% of Americans don't get adequate fiber in their diet. That's a staggering number. 90 to 95% of Americans don't get adequate fiber in their diet. Fiber, as you know, it's all plant-based. It's the residue that is left behind when you eat plants, and that residue is critical for gut health. And I'm going to just take a side step here, talk about the gut microbiome for a couple of minutes. The gut microbiome is the 10 to 12th bacteria that all of us walk around with every single day. They're there for a purpose, okay? And the microbiome feed off the fiber. And we know that the gut microbiome of a standard American diet person is distinctly different than the gut microbiome of a plant-based individual. The microbiome of a plant-based individual is anti-inflammatory versus the microbiome of a standard American diet promotes inflammation. Somebody did a wonderful study where they gave lecithin. Lecithin is a fat that's found in animal products and plants. They gave the same amount of lecithin to a plant-based person and the same amount of lecithin to a standard American diet person. The standard American diet individual converted the lecithin to trimethylamine oxide, TMAO, which causes intense inflammation in the human. And part of the target of this inflammation is the endothelial cell, which is the cell that lines your blood vessels. So it results in intense inflammation of your blood vessels, and this inflammation makes the lining of your arteries sticky. So it will grab onto the floating lipids that are going by in your blood vessels, and this is the start of this atherosclerotic process. Whereas the same amount of lecithin given to a plant-based individual created 0 TMAO. And so that's one aspect. The other aspect is the colonocytes. The colonocytes are the individual cells of the colon who need short-chain fatty acids for optimal colonic health. And where do short-chain fatty acids come from? They come from the gut microbiome interacting with the fiber. So when you have adequate short-chain fatty acids in the colonic lumen, the colonocytes are happy, and the junction between each colonocyte are tight. Whereas lack of adequate fiber that we see in 90-95% of the population results in inadequate short-chain fatty acid production. So the colonocytes are not as healthy. So the junction between the cells are looser. And it's felt that the diseases of chronic inflammation, which are like ulcerative colitis, Crohn's disease, rheumatoid arthritis, psoriasis, psoriatic arthritis, ankylosing spondylitis. The etiology of all of these diseases of chronic inflammation are gut-centered. They originate in the gut. So when you have loose junctions between the colonocytes, in inflammatory bowel disease, it's felt to be a bacterial cell wall triggers an immune response. So because you don't have the tight junctions, the intraluminal contents are able to interact with our immune system, whether it's a bacterial cell wall and bacterial endotoxin or other chemicals within the lumen of the gut are able to go across the colonic lumen and initiate an immune response. So when you turn on the immune system in these diseases of chronic inflammation, there's no turning the immune system off. And it's our own immune system ends up damaging ourselves. This is the etiology or the basis of these diseases of chronic inflammation. That's why the same mechanism of treatment, which are the anti-TNF class of drugs, like you see advertised on television, Humira, Remicade, etc., are useful in treating all of these diseases that I just mentioned. So the adequate fiber is essential for gut health. Lack of fiber promotes colon polyps, colon cancer. It promotes a diverticular disease. Diverticulosis is a disease of Western society, essentially, where there's inadequate water and fiber in the diet. The colon is the last organ of the body that regulates fluid status of your body. So if you're not drinking enough water, the colon is going to absorb every single drop of water that it sees. It's going to have a residue of little rocks, essentially, in the colon, which pack up, build up, and result in increased pressure within the colon. And the increased pressure results in these little hernia sacs to form, which is diverticulosis. When these sacs rupture, that's when you end up with a diverticulitis attack, where you end up with fever, pain, nausea, and vomiting. You end up in the hospital, and if you're lucky, you end up with just getting better with IV antibiotics and nothing to eat. Sometimes people are not that lucky and end up with an abscess, which results in surgery, a resection, colostomy, and all this stuff. And all that could be prevented with adequate water and fiber in the diet. So getting back to John Doe, so he's also going to complain about sleep disturbance. So if the partner is there with this patient, the partner is going to say, oh yeah, he makes these unusual sounds at night. And sometimes I wonder if he's going to stop breathing. So he complains of daytime fatigue and lack of energy. And so he gets assessed for sleep apnea. And sure enough, he has obstructive sleep apnea as a diagnosis, and he ends up with a CPAP machine. This person is going to complain of anxiety, depression, and workplace dysfunction. And so the primary care provider is going to probably put him on an anti-anxiety or an antidepressant class of medicine. He's going to complain of chronic neck pain, back pain, hip pain, knee pain, foot pain. Why? Because the human body wasn't meant to carry an extra 50 to 100 pounds every single day. This extra weight results in wear and tear of the big joints, the vertebra of the spine, and so he's going to complain of chronic pain. And the primary care provider is going to put him on Celebrex or some other tramadol or some other kind of pain management. He might end up seeing a pain specialist and get a nerve block in his back. Or if he's unlucky, he might end up with some kind of back surgery, spinal fusion, hip replacement, knee replacement, ankle surgery because of this problem. Being a male, he's going to complain of erectile dysfunction. How common is this? Extremely common. And seeing in younger and younger individuals. Erectile dysfunction is, I call it the canary in the coal mine as far as representing systemic vascular disease. Systemic vascular disease. Because the process isn't going to be isolated to the sex organs. It's a systemic process that we're dealing with, but simply presenting because that's where this person is having malfunction, a lack of performance. And so erectile dysfunction, very, very common in this patient population. So as you can see, the average person that I see every single day sitting right across the desk from me or in the endosuite is going to have 10 plus different diagnoses. They're going to be on 10 plus different medications. And the American healthcare system, this is where I have issues with. The American healthcare system is among the best in the world as far as diagnosing and treating. See, we are trained as medical providers to make a diagnosis, and the next step is you write a prescription. There's a pill for everything. See, diagnosing and treating is very, very different than addressing root cause of the problem, and addressing the root cause which will result in healing and reversal of disease. This is where the American healthcare system, I feel, really falls way behind in addressing root cause. Unfortunately, we are in the era of corporate medicine right now, where the primary care provider is allotted so much time to see so many people. So when this John Doe comes in the office, you know, they got 10 different diagnoses, they're on 15 different medicines, and she only has 15 or 20 minutes to address this patient. So she can barely have enough time to address, let's say, the hypertension part of it or the diabetes part of it and say, oh, Mr. Doe, I see that your hemoglobin A1C is still 8. We want to see it less than 6. So we're going to add one more medicine to your 2 diabetic medicines they're already on to try and improve your hemoglobin A1C. Or your blood pressure is still, bottom number is still 95. We want to see it less than 80. So we're going to add a different class of medicine to the 2 blood pressure medicine that you're already on. And okay, we're going to check back with you in a month. That's corporate medicine today. Again, it's diagnosing and treating versus addressing root cause and addressing a disease halting and reversal of disease. So I want to talk a little bit about fatty liver, which is one of the big main components of this metabolic syndrome. When I started my practice in 1988, the incidence of fatty liver disease in the United States was 5%. Today, a very conservative estimate is that the US population incidence of fatty liver is between 25 and 30%. And in some locations, it's closer to 45 and 50%. So there's been a 500 to 600% increase of the incidence of fatty liver disease in a very short period of time. And you have to ask the question, why? Why is that? Well, you know, we've looked at it. We've already discussed it. It's the food, essentially. You know, there are some other things that also contribute to it. You know, when people go to work and they look at their little electronic box in front of them, they're seated the whole time. And then after they're working, they come home, they look at the electronic box in front of their face and not really be physically active. Sure, that's contributing to the problem. But the main issue is it's the food. It's the food that's responsible for this. Fatty liver disease is the #1 cause of abnormal liver biochemistry tests in the United States today. When you go to your doctor and your doctor orders a blood panel, which is a blood count and a chemistry panel, the chemistry panel has, we call liver enzymes or transaminases as part of this chemistry panel. Today, the normal is that these chemistries are elevated. It's rare today that in the clinical practice that I see people with completely normal transaminases. I don't remember the last time I actually saw that. Just about nearly everybody, the transaminases are mildly elevated, and this will result in an appropriate workup. And the #1 cause is going to be spectrum of fatty liver disease. Okay, #1 cause. The fatty liver disease is becoming the #1 cause for liver transplantation in the United States. It's taken over from hepatitis C, which was #1 for a number of years. Now, since we have an excellent cure for hepatitis C, fatty liver disease is #1. It's going to stay #1. In my lifetime, it's going to stay #1 for the next generation of doctors. It's going to stay #1 for over 100 years, unless we do something dramatically different that changes the course that our society is headed to. It's a huge problem. And fatty liver disease is a disease, it's a silent process. The majority of people that have this condition are clueless. They're completely aware that they're sitting on a potential time bomb that's going to affect their problem. So there's 2 main forms of fatty liver disease. The majority of patients who have this problem have simple fatty liver disease, which is simply excess fat within the liver, okay? But 10 or 20% of people will have the excess fat with inflammation, which is very, very different. Chronic inflammation for a human is not a good thing, no matter where that inflammation is. So in this condition where we have excess fat with inflammation, we call that NASH, N-A-S-H, which stands for non-alcoholic steatohepatitis. And in this cohort, 10 to 20% of them will go on and develop cirrhosis. Cirrhosis is a pathologic description where the liver architecture is completely distorted by scar tissue, which forms these little nodules. And it's an end organ process, meaning that once you have cirrhosis, it's not a good thing. People who have NASH-related cirrhosis, and cirrhosis, regardless of etiology, have a higher incidence of liver-related cancer. We call that hepatoma. And the incidence of NASH-related hepatoma is one of the fastest growing cancers in the United States today. It's rising at an annual incidence of 9% per year.
Wow.
It's a huge problem. And in a little town like Reno, Nevada, there was 1 week, just a few weeks ago, when I diagnosed 3 NASH-related hepatomas in 1 week. You know, unbelievable. Unbelievable. Small. I mean, Reno's not a huge place, and our practice isn't that huge. 3 NASH-related hepatomas in 1 week, and so the annual cost of fatty liver-related disease in the United States today, $300 billion, and rising on pretty much on an exponential plane. And again, it's all related to diet and the overweight problem that we have. And so this brings the concept of diagnosing and treating versus addressing root cause. And there's 2 points that I want to make here. One is in cardiovascular disease, and I want to come back to fatty liver. Now, if all of you who are watching this should be familiar with the name Caldwell Esselstyn. He's a cardiologist out of the Cleveland Clinic Foundation. And he has incredible data showing how addressing cardiovascular disease with a whole food plant-based diet actually has the best outcome compared to the present cardiology-related care that we have today. In one of his articles that he's written, he has a wonderful statement that he makes. He says, present-day cardiology uses a mechanical approach to treat a systemic disease with no chance for cure. How powerful a statement is that? I'm going to say it again. Present-day cardiology uses a mechanical approach to treat a systemic disease with no chance for cure. We know that the atherosclerotic process is not limited to the coronary arteries. It's simply presenting itself there because the person has angina, meaning that the heart is not getting adequate blood flow. So when somebody has, angina, they undergo a cardiac cath, they got 95% narrowing, they end up with a stent or a coronary artery bypass graft. That's the mechanical approach, okay? Yes, that can be life-saving, the acute process. But if you don't address the root cause that resulted in the atherosclerotic process to begin with, guess what's going to happen? A year or 2 years down the road, the stent is going to reocclude, or the other arteries which were not critically narrowed then will become critically narrowed, and this person is going to end up with another second heart attack or third heart attack, and that's what the data shows. We know that in the US today, 700,000 heart attacks occur every year. 500,000 are first-time heart attacks, and the other 200,000 are second or third-time heart attacks. Dr. Esselstyn's data, he can pretty much look somebody in the eye and say, if you've had your first heart attack, I can guarantee that you're not going to have a second vascular event.
Wow.
And he has 20 plus years of data that supports this. And his data actually has a 3,000% better outcome as far as preventing a second vascular event compared to the best cardiac care that we have today. Not a 10%, not 100% better, but 3,000% better outcome as far as preventing a second vascular event. How powerful is that? Okay. And again, let's go back to the fatty liver thing. Big pharma smells money. Okay. Why? There's 100 million Americans alone in the US that have fatty liver disease today. 100 million. Worldwide, it's 25 to 30% incidence. How many billion people are on this planet? You divide that by 4, we're dealing with a huge number. Billions of people have fatty liver disease.
Yeah.
And so big pharma smells money. That's why there's been so many clinical trials to come up with a drug to treat fatty liver disease. Over 60 have been tried, but there's only 2 to 3 that are in late stage clinical trials now. Whether those drugs are going to be approved or not, we don't know. But let's go back to Mr. John Doe here. The next time we see him in the clinic, he's already on 10 or 15 drugs, has 10 or 15 diagnoses. We're going to look him in the eye and say, hey, Mr. Doe, I got good news for you. The FDA is going to just release the new fatty liver drug. So we're going to add this one more drug to the 10 or 15 drugs that you already have. And that's going to solve the problem. Yeah, you're going to be great. We actually really believe that and ignore the root cause of his problem. Again, that's where the whole healthcare system needs to look at itself and reawaken and address root cause as the first thing that we do. So adding one more drug to John Doe and have him continue to eat the standard American diet is really not going to change his course. He's going to continue to spiral down and suffer needlessly from preventable, reversible diseases, which is going to result in early death. Okay, and I just want to comment one other thing before Mary comes back again, and that's about the pandemic. You know, before all is said and done, there's going to be about 600,000 people would have given up their lives to this COVID virus. And it's interesting that 80% of those hospitalized with COVID were overweight. 80% were overweight. And we know, as what Mary has said and what I've said so far, that the weight comes with consequences. And those consequences are the metabolic syndrome, what we've been talking about all along. And so these people that succumbed, majority of them had these pre-existing conditions of diabetes, hypertension, hyperlipidemia, cardiovascular disease, renal disease, fatty liver disease, NASH-related cirrhosis. And when they had all these conditions, they come down with the COVID on top of all of this, boom, that's why they succumb, and that's why 600,000 would have died. And the question is, again, is this going to be a once every 100-year event? We know that the Great Flu in 1918 wiped out millions of people, and literally 100 years later, we have this huge COVID thing worldwide. And is it going to be 100 years before we see the next one? No, absolutely not. I feel that this is going to be much more common. And are we going to see COVID 2023, 2025? Who knows? But I think that's much more of a reality. And again, you can approach this as we're going to wait on the system to save us, meaning we're going to hope if there is a COVID 2025, that people will come up with a COVID 2025 vaccine sooner, or we can do things on our own to be ready to be able to survive and thrive in these times of unpredictable pandemics coming forward. The way you can prepare yourself is what you're eating. It's the food. Not to be overweight, not to have fatty liver, not to have diabetes, hypertension, not to have the metabolic syndrome, to have a healthy immune system, to have clean arteries, are critical to survival of future pandemics, which are clearly coming our way. So I've said enough.
Well, you know, Dr. Matossian, are you familiar with the work of Dr. Hannah Kaliova of PCRM? Because they did a study giving people a plant-based diet. I think it was for 4 weeks, and they actually reversed fatty liver.
Yes, absolutely. That's what I'm getting at.
Yeah.
You know, and again, absolutely. See, the problem is, I've never seen a kale or a quinoa or spinach drug rep come to my office. Okay. And believe me, the instant that the fatty liver drug becomes FDA approved, they're going to be coming down, knocking down every primary care doctor's door and saying, hey, we got the cure for fatty liver. It's just one other pill, as opposed to addressing root cause that we all know is far superior as far as addressing these chronic diseases, which are preventable and reversible. Absolutely.
It's like that old saying, mopping up the floor, but not turning the faucet off.
Yes, absolutely. You bet.
Yes. Yeah, very good. Okay, so I just need to, I'm going to have my slides come back on again. We're going to share the screen. What do I do? And then we're going to go just talk a little bit about lifestyle medicine. And at the same time, I'd like to just talk about my personal challenges, because I thought, I really have this dialed in. So we have the option between toxic pills and surgery. And then of course the lifestyle change has got an empty line. And it is hard. And I do want to bring up that food addiction is an enormous problem. And then when we tell people, oh, no problem, you can completely reverse your disease processes if you just give up everything you're eating and stick with plants. And I really had given people the opportunity to be disappointed, number one, and to mourn the loss of these great friends that are no longer serving us. And it was a very dramatic, it was October 10th of 2016, where that weekend we were plant-based. One of the things that a lot of people complain about is they say, I don't feel good. I just can't live without my chicken. I feel weak. I feel terrible. And I had a lovely conversation with Dr. Alan Goldhammer. And one of the things that happens is, you are absolutely right. You don't feel good for that first month, because suddenly the hormones that are being stored in the fat, the toxins, the cholesterol, it's re-entering the blood circulation, and we don't feel good. Suddenly we have this major dip in how we feel. And so when people are allowed to just go, okay, I really need to ride this wave and give it a month or 2 months, then I'll be feeling better. One of the things that which I explore thoroughly in my book, was when it became clear to me just how toxic chicken is and just how toxic beef was, I had to rename it. So when I renamed my food, I no longer could have this relationship with cyanide. Would I ever in my lifetime ever consider trying cyanide or trying arsenic or getting in a car and going down the wrong side of the highway or grabbing a rattlesnake to see what it would feel like when he would bite me? Well, no. And humans, we don't like to get harmed or injured. We don't like to get into harm's way. And so when we really come to terms with just how bad certain foods are, it's clear that we're not going to touch those foods. And that's where renaming the food was very, very important. One of the things is, I thought I was so special eating plants, and there was a little bit of arrogance in me and how I should go through my day. And I thought, I'm so special, I don't have to exercise, and I can eat all day. Well, that didn't work. And I realized I had to come to terms with distancing myself from sugar and from flour, and choosing not to make that a part of my day. I also had to really cultivate my spiritual life. And I'm going to go on to the next slide here. I just want to gently move on. Here it is. Let's work together. That this was a big change, and this was an important change. And I had recently discovered Dr. Nedley's New Start program at Weimar, the Weimar Institute, which is about an hour and a half north of Sacramento. I went in September, and I thought, oh, I know everything. They're not going to tell me anything I don't know. And sure enough, I was really surprised that what they do is they first of all, it's an 18-day program. The second, third, and fifth day, they do a 3-day water fast. They keep people very, very busy, distracted. We go for walks. We have massages. We have these amazing lectures from Dr. Gallant, Dr. Kuninobu. And then their thing is just the 2 meals a day. So it's 8 a.m. and 2 p.m. Some people do 9 a.m. and 3 p.m. And when I could finally shift my focus into 2 meals a day, that's when I started losing my body fat. That's when my weight started coming down. And that's when suddenly I had a lot of time on my hands, because I wasn't eating all day long. And so it was very, very powerful. I just want to show you this fabulous little glass here. is that this is a half a gallon. So one of the things I had to do is start taking the time to prepare my meal in the morning. That would be grains, half a cup of beans, 2 servings of fresh fruit, and eat the food and sit down and just feel that sense of being full. And then I would tag in when I would be eating in the afternoon, 2 p.m. I knew exactly what I was going to be eating. And yes, I felt hungry. I felt very hungry. And I had to change my relationship with feeling hungry and understand the tremendous positive benefits of feeling hunger. And so in the afternoons, I would do the fluids, water, between meals, not during meals. One of the things I was doing is I was drinking a ton of water while I was eating, and it was just pushing the food through my stomach too quickly. So that was very positive to realize I need to eat before meals, between meals, and after meals, and not during meals. And so this was very positive and very powerful, and that eating food is serious business, and I just need to stay focused on this. And it doesn't get easier as we get older, is that this challenge and struggle with food will be with me for all the days of my life. And I've never felt better. It's almost like learning how to ride a magic carpet. It's like giving up a diesel pickup truck and having a GMC Hummer electric car. I'm gonna move on to go on to this one here. It's the food.
Yeah, well, I just want to say a few things. Why is it that only 2% of our population is plant-based if the data is so overwhelming? And this is an important point Chef AJ has done an incredible job as far as promoting this information. And that's what our purpose here also is to make this information known to the average person. But it's still only a very, very small percentage of the US population is plant-based. And I feel that there is a purposeful confusion or deception, or we call it fake news out there, that the purpose is to confuse the public. And so when the public is confused, it's much less likely to make a change in their habit, okay? And so I love, like, the 2 main fakes that exist today are that you need milk for calcium and for strong bones, and beef, it's what's for dinner. You need animal proteins to be strong and have healthy body repair. Both of those couldn't be further from the truth. I just love what John McDougall says about dairy. I mean, he says, milk, it does the body good if you're a baby calf. But otherwise, for humans, I don't think so. And so just a very simple point of that is that calcium, which is a mineral. Minerals come from the soil. And when plants grow, they incorporate these minerals into their substance. And by eating the plant, you get all the benefit of the calcium and the minerals that our human body needs. We do not need to go through the cow, the middleman, to get the calcium that we need. Where do you think the cow gets its calcium from? It gets its calcium by eating the grass. And the same thing with protein is that plants actually have more protein by weight than the leanest of animal products. And animal products come with all the cholesterol and bacterial protein toxins and all these other things that our body doesn't need. So you have to be careful about this purposeful confusion that is preventing more people from entering the plant-based movement. More people die every year from the standard American diet than all the cigarette-related deaths combined. That's an important concept to get in your head. More people die eating standard American diet every year than all the cigarette-related deaths combined. It took the US government hundreds or thousands of studies in 20, 25 years before they would create a little warning on a pack of cigarettes. If you smoke, it's going to adversely affect your health. Do you think the day is going to come when the same thing comes with food? Like if you eat steak and eggs, or eggs and sausage and bacon and white bread with butter and chase it down a big glass of milk every day, that's going to adversely affect your health? Do you think that warning is going to come? No, it's never going to come. Not in my lifetime, not in the next generation or the generation to follow. That's why it's so important to get this message out through like Chef AJ and others, that what you eat is critically important. We know that 70% of all death comes from chronic diseases of our own making. That's an important sentence there. 70% of all death comes from chronic diseases of our own making, meaning that it's preventable and reversible. 90% of adult onset diabetes is preventable and reversible. 80 to 90% of all atherosclerotic vascular disease is preventable and reversible. Up until when Mary got me introduced to this information 4 years ago, I thought, I was on top of my game. I would read the journals. I would go to National Society meetings. And I did not know that atherosclerotic vascular disease was a reversible process, even though I considered myself a up-to-date type of provider. And so this is critical bit of information. People come and tell me that, oh yeah, my genetics. Well, diabetes runs in my mother's side. Everybody in the family has diabetes, or everybody has had a heart attack, or everybody dies from cancer, so I know it's going to get me. Well, I come back and tell that person that yes, genetics is important. It's something that we're born with. Obviously, we can't do anything about that, but genetics represents a potential. It's a potential. It's a potential that can either come true, or it's a potential that will remain a potential. And what you do in your life, you will clearly affect which direction your body takes. And you have way more power to choose your direction than you think. And it all depends on what you put in your mouth that directs whether the potential comes true or the potential remains a potential. That's a critical bit of information that people who think that they're going to get it because it runs in the family, I counter that that's not necessarily true at all. And one other thing is that we talk about cost savings. One of the things that we bring up to get people to consider plant-based. And, it's true that a pound of kale or arugula or spinach is certainly going to be cheaper than a pound of filet mignon or salmon or chicken, whatever it is. But that's not where the true cost saving comes from. The true cost saving comes from the fact that you're going to be able to halt disease, reverse disease process. You're going to be able to break your chain of the chains that confine you to the healthcare system. You're going to be able to get off or reduce all the pills that you're on. You're going to be able to reduce your risk of having unnecessary surgeries, cardiac stenting, bypass, bariatric surgery, hip, knee, foot surgery, back surgery. And you're going to be able to break your reliance on the healthcare system and enjoy true health and reversal of disease. That's where the true cost saving comes from, not the fact that a pound of kale is cheaper than a pound of steak, okay? One of the biggest issues that I have is, unfortunately, the healthcare providers really, it's disappointing because they either do not know this information or deny this information exists. And so we're left with medical providers that are part of the problem in a way, because if they're they're consuming the standard American diet, then they're not going to tell their diabetic metabolic syndrome patient that, did you know that by simply changing your diet, you could get off your Lipitor, you could get off your diabetes pills, you could get off your blood pressure medicine, that you could actually heal yourself and reverse all the diseases, because they don't know this information. And I still, when I go to these national meetings, I stand out because there I am having salad and everybody around me, they're having filet and lobster with butter and salmon steak and chicken and all this stuff. And I have to tell you this funny story. I know I'm not sure about time, but just another minute or two. The hospital that I belong to, once a year, they have this doctor appreciation luncheon. It's a big deal. And so we get actually an official invite envelope, and it's all, you get invited, and we go down. And me and my GI colleagues went down. It's all white tablecloth. You have all these volunteers that come and serve us, and it's a big deal. So it turned out to be a buffet. So I grabbed, my colleagues are in front of me, and I grabbed my plate, and the first thing on the buffet is pulled pork. The second spot on the buffet is ground beef with a layer of oil just sitting over the ground beef. This is so that you could make your own tacos. The third thing was macaroni and cheese, again, with a layer of oil sitting over the cheese. And my colleagues are there, filling their plates. And one of them looks back at me and looks around and said, "Hey, what's wrong with you? You're not going to eat anything?" Because I didn't have anything on my plate. And I said, "No, I'm waiting until I find something that I can actually eat." And sure enough, at the very, very last station on the buffet was rice and salad. So I ended up having some rice and salad. So here it is, the hospital system that's, commemorating a doctor appreciation, and unknowingly is actually poisoning us with toxic food that's going to adversely affect all the medical providers. And the medical providers unknowingly are consuming all this toxic food, not realizing all the damage that it's doing to themselves. So that's where we are today. And one other short example is a friend of the family. They went and visited their father, who just had a heart attack. And he was in the cardiac care unit, the cardiac ICU. And he was there the day after his admission where he had the acute heart attack. So she was there when breakfast came in. So guess what came in for breakfast? It was eggs and sausage. Here it is, cardiac care unit, eggs and sausage. Are you kidding me? I mean, it's just, I guess it's good for business, because they know that this guy, they put the stent in, he's going to be back in a year with a second heart attack. So they're going to put in, if he survives that, he's going to end up with another stent or another bypass, another $200,000 bill, whatever it is. But this is how far we are from where we need to be. And so my job now is that I'm fortunate enough that I have medical residents and medical students that rotate through the GI service. So I have a captive audience, and I discuss these issues with them. I tell them that I'm going to tell you stuff that you're never going to learn in medical school, or you're never going to get in your residency program. And I give them the articles, I show them the data about how critical it is about food and how it affects us, and halting and reversal of disease. So we have a long way to go. And again, Chef AJ, yourself and others that are promoting this, thank you for doing that. And I couldn't agree with all your efforts that you've been doing for this movement.
Yeah, big time.
Thank you so much, Dr. Matossian, and thank you for what you're doing to educate your patients, and I assume your colleagues as well.
Yeah.
Yeah. I just want to show you just so quickly. This is my strawberry tofu cashew mixture. I had this for breakfast. Oops, I'll put it up there. Can you see that? And that's the bottom. This is my new favorite spring dessert. This here is the cranberry chutney. It's with frozen cranberries and celery. And then I put a little bit of fresh mint, and then I do broken pecans, and I put them together. And we serve this as a very light spring dessert. So it's quite delightful. And like I said, we also have it for breakfast. We can, put granola on it, have it in the morning. And then the chutney is a very popular salad as well. So thank you so much for your time and giving us this opportunity and to share the abundance of this movement.
Oh, that's my pleasure. I noticed we put the recipe in the chat. I thought you were actually going to demonstrate it, but it is a fairly easy recipe.
It is. And men love the cranberry salad, and this is almost a fabulous yogurt replacement because it has the fresh lemon in it. It has honey, tofu. You have to use soft tofu and soaked cashews, and it's quite delightful. And I usually use frozen berries or fresh berries. It's excellent. Very tasty, and everybody loves it.
I just want to mention on your book, you got a little endorsement from Marianne Williamson. That's pretty impressive.
Yes, thank you, thank you. Yeah, we just keep throwing the net out as far as we can. Anybody that wants to hear our story and listen in, and people are curious, especially young people. I'm amazed at how curious young people are, and it's truly, if we do this for the rest of our lives, we just feel totally blessed to be able to do this. So.
Well,
Yeah.
thank you guys so much. It's a pleasure meeting you. And please check out the book, I Love Bacon. I put a link in the chat as well as the recipe. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow at a very special time, 6 p.m. Why so late? Because the guest is in Singapore, and that's like her 8 a.m. She's a registered nurse that works at a retreat there. Her name is Nikki Bravada. If you've watched the Truth About Weight Loss Summit, you may remember her. And she's going to be talking about toxins and how they disrupt your hormones and your immunity. Thanks so much, Matossian family.
Okay.
Take care. Bye-bye.